We did masks, social distancing. What did we learn to prepare for the next one? Airports, travel. You said something earlier about influenza, that you don't need airplanes to have a virus. You can do it through birds. So just maybe talk from your standpoint of preparing for the next one.
Well, I think the same lessons that came out of 19 are confirmed by this one. Number one, tell the truth to get the public on your side. Certainly don't divide the public. Tell the truth, keep a consistent message, have a credible spokesperson. That's all sort of the same thing. Number two, these so-called non-pharmaceutical interventions work. They work better than any of us ever imagined. You know, I supported them, but based on the 1918 experience, I was kind of skeptical about how well they would work. But we have learned, much to the amazement of the public health community, that if you do it right, you can contain even a disease as transmissible as this one. And this is more transmissible than influenza. You know, I cited, Australia a few minutes ago. They have fewer than 1,000 deaths out of 25 million people. That would be the equivalent to 13,000 deaths in the United States. Taiwan hasn't had a case of influenza of COVID-19 since April 13th. You can do it right. We didn't. It's that simple. But those are the lessons, that it is controllable. The other thing is the technology. Because the Bush administration really started this massive program to prepare for a pandemic. They expected it to be influenza, but it applied to any respiratory disease. Part of that was putting money into basic scientific research on vaccines. And as a result, that's why we were able to get the vaccine so quickly. There was an infrastructure, there was a platform of how to make a vaccine that could be applied to basically any virus. And they just plugged in the genetic code for the spike protein into this platform that already existed, that had been developed. Hopefully in the future, we'd be able to do it again, but not every virus is as susceptible to a vaccine. We've been working on a vaccine for HIV for 35 years, and we haven't gotten there yet. Same thing for influenza. We've been working on a vaccine for influenza. We have vaccines, but they're not nearly as effective as the one against COVID-19. So improving the basic science, investing in basic science, investing in the public health infrastructure. That's one of the reasons why the vaccine rollout is so screwed up, is because there's essentially no public health infrastructure. Again, another basic scientific investment in broad spectrum antiviral drugs. We originally thought that we would have drugs that worked against COVID-19 before we got a vaccine. We really don't have any effective drugs yet, except for dexamethasone, which helps significantly, but that's a long way from a magic bullet. Investing in that area of research, further investments, vaccine and public health infrastructure, and telling the truth. I think those are the main lessons. That, and maybe throw in one other thing, and that's surveillance for new viruses. The biggest concern had always been an influenza pandemic like 1918. The World Health Organization did create a worldwide surveillance system looking for new influenza viruses. So it'd be alerted very early in the process. That needs to be expanded. And again, countries have to tell the truth. China did not tell the truth in SARS. They improved a lot when we were concerned about bird flu. They did not tell the truth in COVID-19. And they're still hiding it. I think it was yesterday, they're still negotiating. Earlier, they had agreed to allow WHO investigating team into the country to try to track down the source of COVID-19. And yesterday, it turns out they're not letting that team in. They're, quote, negotiating, unquote, over what they're going to do. So they're still not willing to tell the truth in China.
So if you like this little short clip from an interview I did, click over here to watch the entire interview. And please don't forget to subscribe to the channel. Take care, everybody. Bye-bye.